Hi, thanks for coming today. We're going to do our regular training session for bone density building and muscle tone, but we're also going to focus on plantar fascia on the feet and ankles. And we're going to start out with just a couple of minutes, just 5 minutes of soft tissue work. So if you could get a massage ball if you have one. You can also use something like a tennis ball. I always like to make sure we do the pecs a little bit and the upper trapezius so we'll have better posture and better alignment of the joints. The best way is if you can be in a door frame and have the head relaxed, and you just want to massage out the muscles in the chest, below the collarbone, and out by the underarm. And so the session today, we're going to not do our regular alignment series, but rather a specific mobility and exercises for the plantar fascia for the feet. Okay, and the other side of your chest. Great. And then from here, we're just going to go to the floor. The only thing you'll need here is a massage ball. And now we're going to work on, actually a foam roller also. If you have a foam roller, we'll roll out the quads, the glutes, and the upper traps. And also work on the neck. So just kind of quickly here. When we do the glutes, we'll be going around the perimeter. So just like this, around the sacrum up here, along the iliac crest, and around the femur and down by the coccyx, by the tailbone. When we work on the upper trapezius, right here between the base of the neck and up to the shoulder, that area, and slide down a little lower around the shoulder blade. But initially, we'll do this part here. So along the skull, you just want to put the ball in a few different places along the base of the skull. And I don't typically roll around much. I just get the ball in place. And it's easiest to do that if the ball is on a book, depending on your neck angle. So just right, you can feel the edge of your skull bones and the muscles in the neck, the suboccipital muscles that attach. And I'm sure everybody's a bit sore. As I said, here we've had feet of snow, not just a few inches here and there, day after day. Vast quantities and very cold temperatures down to -40 Fahrenheit, I would say. Okay, other side along the base of the skull, so just work your way. And in terms of the feet, when you're wearing boots, it really restricts your ankle mobility and the plantar fascia, so that you'll get very stiff and also weak. Okay, next we're going to work on the upper trapezius on the left side. So if you just put the ball left side base of neck and left arm up. And here I'd like to move cross fiber side to side. The session today will be structured that we'll do here just a few areas of soft tissue, then plantar fascia work, and then deadlifts and chest pressing for our bone density and muscle tone building. And then at the end again, we will do more integration and strengthening for the plantar fascia and the knee and the hip connections. So the work we do will really benefit knees and hips as well. Okay, and now on that same side, you can just take the ball down along the edge of the shoulder blade a little. And I would expect a lot of people are quite sore here. Okay, and next we'll go to the right side. So just at the base of the neck and between the neck and the shoulder. You would just go side to side here. The right-handed population often have a higher left shoulder. And when you're working on the upper trapezius, it's common, I've found, for the right-handed people particularly, that the left upper trapezius is more sore. And when you get over to the right side, sometimes it's nothing happening there. Okay, and on the edge of the shoulder blade a little. And you don't necessarily have to move. You can just, put the ball wherever it's a bit sensitive. Fine. So next we're going to work on the glutes. So you just take the ball and lift the left hip up a few inches. And the ball is not right in the middle part, but more on the outside at the back. Then straighten that leg. And if you just tip the hips up, the ball will settle into the socket of your hip joint where your femur is set. So I like to go around the edge of the femur with the ball, if you can feel that leg bone and the gluteal muscles. And then turn toward your back, and now the ball will be closer to the tailbone, down at the bottom part of the glutes. Okay, and then up more vertically. So the bony structure in the middle here is called the sacrum. And you can work your way up along the edge of the sacrum. And then when you hit the rim of your pelvis, the iliac crest, you can follow the edge of the bone out to the outside of the hip again. And here your glutes, gluteus medius, for most people will be quite tight. Again, slipping and sliding out here in this deep snow and ice. Okay, and now we'll switch to the right hip. So you just lift the hip up a bit, straighten the right leg, and tip the hips up on top of the ball a bit. Okay, so we're going around the edge of your femur. And then if you turn toward the back, so at the bottom of the pelvis, you could say, and on the back near your tailbone, and then up vertically along the sacrum. You can do this also standing up against the wall, but obviously your body weight will apply more pressure. Okay, and then if you could keep going up until you hit the rim of your pelvis and follow that edge out to the outside on the right. Okay, and next we're going to work on releasing the quadricep muscles, the front of the legs. So if you have a foam roller, you can, even if you don't like to be face down, you can sit in a chair, just roll it around. Rolling pin works a lot for people who don't have very good mobility. But if you're able to, if you could work on one leg at a time. So I take the rollers out to the right side, and you have only the right thigh on it, starting just above your knee. And we're going to gradually work our way up to the hip, incrementally here. And you can also turn your leg in different angles, but not directly on the side of your leg, on your IT band, still on the front, so it's the quadricep muscles, but the lateral quads. And then when you come to the top, you work on the hip flexors just in front of the hip, and also on the TFL on the outside of the hip. Okay, and we'll switch now to the left leg, and always making sure we have really good core support here. Okay, so just above the knee and incrementally work your way up. Then you can rotate the leg slightly. So you're a bit more on the outside, and then the middle, the inside, and then up in front of the hip. And now turn to the outside of the hip. Okay, and now we're going to start working on the feet. And for the first exercise, you could please just sit in a chair. If you have issues with your hips or knees, again, this series will be very helpful. So the first thing is just scrunching the toes. So you like to spread the toes and then scrunch the toes, spread and scrunch. If you have gout, this will help to clear some of those joints. If it's painful, obviously you just do what you feel tolerable of. But if you're on the floor, you should sit like this with the fingers out to the sides, and you want to have the chest up and chin back. Try not to sink down like that. Or you can just sit in a chair. So now we're just going to go scrunch and spread at your pace. So here we're working on circulation. We want better blood flow into our toes. We'll spend about a minute in different angles to help improve circulation. And the plantar fascia, so it's the muscles or the tissue in the bottoms of your feet, the connective tissue. And often boots, for sure, we don't use our feet very well because the boots give so much support. And of course we wear shoes and we don't use our feet enough. And so plantar fascia often becomes weak and can, get inflamed because it's weak. So we want to not just stretch, but also strengthen. So next, this for sure is easiest to do on the floor, but if you can't, you can sit in a chair. Now we're just going to flex and extend. So your ankle joints, for today, we're just going directly forward and back. Other occasions, we'll do ankle circles and more specifically, different directions of the joints in our feet. But today we're just going to do this flexion extension for now. Later on in today's session, we'll be loading. That means we'll apply resistance for strengthening the angles of rotation, the ankles up to the hips. Okay, so the next is we'll stand up, and you can either sit in a chair or do this just standing. And the action is to keep the big toes pressing to the floor, lift the other toes, and keep all the other toes down and lift the big toes. So if you're not able to do that, you can sit down and just hold those toes down and lift the big toe, hold the big toe and lift the other toes. And as you do that, if you can note even your own ankles or mine, as you're doing that action, you'll notice you'll get a little bit of a rotational movement in the ankle joints as well. And this will help to strengthen and mobilize the plantar fascia. Okay, and that for some people, this might be quite easy. Others, you'll probably have to practice. If you have toes, that overlap and bunions and all that, this totally applies, right? Okay, so I'm going to just take the camera up for a second here. So next, standing up for everybody. Okay, so you'll just be standing. And we're going to use either, if you have a broomstick like this, and just we're going to walk over it a bit and then move in different angles on it. And after that, we'll use a massage ball to help break up some of the dense tissues in your feet. I have this thing, it's called a soulmate. It's made out of cork. And I use this one instead of the ball. So I'm just showing you you're just standing up, and we'll be working on remolding the tissues in our feet. And of course, if you have some sharp pain in your heel or something, I wouldn't particularly press on that sharp pain, but more on the muscle or the soft tissue that's maybe a bit sore for everybody. Okay, so first we're going to just walk over. If you have that broomstick, you'll just kind of walk over the broomstick like this, small steps. And if it feels very painful, then again, you can just sit in a chair and start massage out like this. You can just roll it in your feet a bit like that. I'm just going to walk over a couple of times. I would do that more extensively, but we have a lot to do, so I'm just going to keep going here. So then I like to go sideways like this. So you see you can help get into the joints in your forefoot here a little more. So here we're still mobilizing. Okay. And then now the ball. So here we'll put the broomstick aside. And if you have a ball, you would just roll it around. I mean, I think this is quite commonly done for people, right? You just take the ball and roll it around like that in your feet. Particularly wrap around the forefoot like that, like wrap your toes and forefoot around the ball. But that's circulation. So here we want to remold. So if you can also press down. So just in different places on your foot, you try to apply some pressure. I use this, like I said, it's called the soulmate. Same idea in different parts of the foot. What I like about the edge of this one, people might have those foam rollers that are cut in half, and it has the same kind of design as this. And you can really get good pressure on the arch. So this is a lateral arch on the outside of the foot. The transverse arch is in the forefoot. And the middle arch, I mean the medial arch, the big one that we all think about when we say arch. So you just want to work different angles and not just like roll around loosely, but also just try to apply a bit of pressure. Okay, so now this is where the fun starts. So again, I'm just standing, right? I'm standing upright. So this is, I'm using this soulmate thing. If you don't have that, then you can use a towel. So here's my rolled up towel. And it's good to have this edge, so it's rolled up and then you've got this like edge, okay? And we're going to work first on the toes. We're going to do a toe stretch. So here your forefoot is on the floor and the toes are up. You see that? And then we're just going to step forward and back a few times and then do a stretch for the toe box. I'm going to use this because it's more firm, works a little better than the towel. So we'll start with left foot, everyone. The forefoot is down, toes are up. And you'll note that that lengthens your toes. So if you have like hammer toes or bent toes, this will help straighten them. Then just step forward and back a couple of times, in front and back. Then take the right foot forward, keep it forward, and now your foot, keep the forefoot down, keep your left leg straight, and bend the toes, particularly the ball of your foot. Okay, some people it will be painful, right, in the ball of your foot if you have a bunion. So just, again, do what feels comfortable enough for you. But the objective is to flex your toes or extend the toes. And generally, I would hold about 30 seconds in each position. Okay, and now we'll switch to the right foot. So the forefoot is on the floor and the toes are up on the towel. And then you just step forward and back a couple of times. And then bend like that. Keep the ball of the foot down. Try not to twist your ankle. Oh yeah, the toes. Make sure the toes are pointing forward. Don't out toe. You may have more restriction. Gradually work on aligning the foot. And the back leg should be straight with this one. Okay, and rest. Fine. So now same idea, but now more calves, okay? So the towel, this time, your heel is on the floor, but the foot is up. And we'll do the same kind of a sequence like that, forward and back. If that's too low for you, you could put it on a book or something so it's a bit higher, it depends. Some people really are very stiff, others are too loose. So left foot we'll start with, and just go forward and back a few times. Okay, and now step forward with the right foot. Make sure your left foot is angled forward, not out to the left. Don't pronate your ankle. Keep the ankle neutral. Like, don't let your ankle go in and twist your knee. If you can do it, you take your right foot and walk around in front of the left foot. So what I mean, you're like this. And this foot's in front, and I'm walking it like this across, like that. Keep the back leg straight. And then you'll note you'll get more rotation. You'll feel it more around, well, depending on you, some people more on the inside of the shin. Definitely helps to even out the tension around your ankle joint. And again, we would typically hold about 30 seconds. And walk the foot back. It's important that the knee is straight. You don't want to twist the knee. So left foot is up, heel on the floor, and the foot is up. And then walk forward and back a couple of times for rotation. Just warming up, mobilization. Okay, then take the left foot and walk, if you can, right, only if you can, walk in front of the right foot a bit. Keep the right leg straight. And standing tall, keeping the hips square in the direction of rotation. Okay. And again, you'll feel at different places stretching in the calf. And walk the foot back around. And then done. Okay, so next component is that was our mobilization work and the stretching. And next we want to create a better integration of the feet up into the hips. So we did this recording a while ago for this component, but you'll be standing up, and I like to use a hacky sack. But if you want to, you can use a sock, like a rolled up sock. The objective, as I said, is what we just did to move your ankles around. Well, if you just walk a couple of steps, you'll notice how much better your toes are bending and your ankles are moving more comfortably, right? Okay, so now for the hips and the knees, be sure that the knee and toes and hip are facing forward. Don't let your knee go in. So that I have this on the right foot, and the foot goes, it's in the forefoot, okay? Foot goes forward and then back. Forward and then back. With the front leg, you have to be sure that you don't let the knee, as I said, go in. The knee should stay centered, pointing forward. Okay, and now we'll switch feet. Okay, so the foot goes first forward and the knee is pointing forward. And here, the glutes, so make sure you're using your gluteal muscles for your hip. So you see, if the ankles are not moving optimally, then the hips and knees will have to have extra torsion. And rest. And so we always want to make sure the knees stay centered and not are twisting side to side. And that leads me next is going side to side. So you have to watch out for the knee. This is great for the hip rotations. For the internal external rotators of the hips, the leg goes behind, like a curtsy, like that, just close, and then out to the side. Directly, the feet are parallel to each other, okay? Cross behind and then out to the side. Be sure that you don't do this, like let the hips dive forward. You think of your hip hinging, the hips are going back like that to hold the knee in place, or else you'll put pressure into your kneecap. Okay, so let's start. Left foot is supporting, right foot is moving, cross behind, curtsy. Keep the loading on the left leg. Your left leg, don't shift onto your right leg. The leg is going to the side, but your body weight is on the left leg. Cross behind. The right foot goes to the side, but your body weight is on the left leg. Use your glutes. That's excellent. That's exactly the idea. Cross behind, out to the side, left glutes, left glutes, left glutes, and come to center. Switch sides. In a training session, obviously, you could do more reps. Okay, so left foot, or I'm switching feet, whichever you're doing. First is cross behind, and then to the side. It's important that when the leg goes to the side, the feet are parallel, not that moving leg shouldn't go back when you go side. So you go cross behind first, and then bring the feet out parallel. Body weight on the non-moving leg all the time. And rest. Okay, and then for, again, hip hinging here, we're doing, if you have your hands on your legs and just push the hips back a bit, keep the hands, arms are straight and your hands are on your knees. Then take the hands just hanging under the shoulders and lift the heels up, only a bit, like a half an inch, and hold. Just continue holding so that you integrate, again, the toes up into the hips. You shouldn't feel this in your quads really, glutes and toes. If you do feel mostly quads, push your hips back more. Make sure the knees are not diving in. And then stand. And fantastic. Okay, and then we'll take a moment here, just walk around. And as you're walking, you could take note of how your feet are feeling. Walk very slowly and controlled with the toes angled forward. As you're walking, make sure you bend your toes and bend your ankle. If you have toe spacers and you'd like to use them, that's what I'm doing. I'm just putting them on now. We've mobilized our feet, and the toe spacers will help you, or actually just force you to strengthen your toes and feet more, the plantar fascia. It's when you use an arch support, like it's doing the work of the arch. So your arch could, that may cause the arch to become weaker, right? But when you have these toe spacers, it's forcing your toes apart, so it makes your arch work harder. Okay, so next, if you want to do the deadlifts, here we're going to use a heavier weight according to you. Now we're working on building our bone density. The feet will be, for the first set, just slightly wider than hips. The action is what we just practiced, hip hinge back. We're going to be doing sets of 20. So first set, feet are neutral. The weight should travel vertically between the feet, like this. Make sure that you don't push the hips forward like that. That will hurt your knee joints. Okay, here we go, hip hinging first set. And just standing tall first, chin in. Take note of your feet. You can feel the toes and the heels. Your arches look how strong they feel. Chin in. Okay, good. Now hip hinge back. And think of pressing your feet into the floor. Every rep, stay in contact with the feet and press them into the floor. And rest. Good. And good. And just walking around a moment. Okay, now we want to work the different angles of the hips, just like we did with our movements earlier. So take the legs this time wider, so you'll get more internal, external rotators of the hips. And only the left hand is holding on for our rotational core work. The palm should be facing forward to externally rotate the shoulder. Hip hinge back, exactly the same as we just did. And pressing the feet through the floor. Rest. And switch right hand. Okay, palm is forward, shoulder externally rotated, chin in, hip hinge, and stay in contact with your feet. Okay, and rest. Good. And then walking a moment again. Okay, for our last set, we'll again have the wide stance. And this time the focus will be the glutes. So as you're lifting, when you do your hinging action, think of squeezing the glutes together like that from the sides, like someone's squeezing your buttocks from the sides. Okay, a bit of a wide stance. The knees should always point in the same direction as the toes throughout the movement. Okay, chin in, brace your abdominal muscles. Good, hip hinge. And feel the glutes engaging. Feel like someone's squeezing your buttocks from the sides every rep. And rest. All right, and now we'll put the weight down. Okay, this is not too bad. So I'm taking here, I have this band and I'm attaching it like you could attach it around a couch or something. The bottom of a couch or a chair. Okay, so here we go. So here's the band. Now it's best if you have some kind of Velcro thing to hold your leg in place. To hold the band in place. I'm not going to take the time to do that. Okay, so those of you who have hip issues and feet ankle issues, this series that we're going to do is really beneficial. We're going to go through every angle of rotation. So first we're starting with, now you'll have to just have this intention. The left foot is supporting, the right foot is moving, okay? The band is attached in front of you, and you see the band is attached in front of me, and I'm just pulling straight back. So just imagine you've got a band around your right ankle, the band is attached in front of you, and you're pulling your heel straight back. Okay, and now we're switching. So left foot has the band, right foot is supporting, and we're just pulling straight back. Okay. And for the next part, the band will be attached at the sides. So now I have the band around the right foot, around the ankle. See that? And so my right foot is to the outside. The band is attached to the left. It's on the right ankle, and you go cross behind. Okay, and now we're switching feet. So the band is attached to the right. If the band is around the left ankle, and we're pulling out to the left. Okay. Band is around the right foot. The band is attached to the left. We're crossing from left to right. So you're pulling out to the right side in front of the left foot. Okay, and switching. The band is attached to the right. It is around the left ankle. The left foot moves in front of the right foot, out to the left side. So now we're external, this is externally rotating the left hip. Abducting, this is your hip abductors that you're strengthening with the band attached. Okay, we're switching feet. So now we're working the adductors, so the inside of the legs more. So now the band is around the right foot, the band is attached to the right, and the foot goes across in front of the left. Okay, and then switching. It's around the left foot. The band is attached to the left, and now we're crossing in front of the right foot. Okay, and switching. The band is around the right foot, and the band crosses, is at the right side. Band is at the right side. This time you cross behind the left foot. Okay, and switch. The band is attached to the left. It is around the left ankle, and we're crossing behind the right foot. So this is your adductors, ADD, adductors of the hips. When we did the first version, pulling out to the side, that was the abductors. So I'm switching again, and last one we'll do just a bit of flexion. I don't work too hard on this one because we do too much hip flexion in life. But the band is attached behind you, and you're pulling forward. Okay, and then we switch feet. So I'm in the left foot here. The band is attached behind me, and just pulling straight forward and back. Good. And so you've seen we've done every direction, forward and back, side to side, in front, behind. You've done it all. So it's just a really great system for strengthening the hips in all those directions, and also the plantar fascia, the feet and ankles. So we're going to just do one last thing if you want to. So now we've strengthened it, just walk around. Okay, so we're going to walk, and you can lift the heel up and the toes will bend. And you'll notice you have better range of motion in your feet. Like that feels great actually, particularly when we're wearing stiff boots. So generally what I would do afterwards is stabilization work for the hip, like just like 30-second hold, hip hinge holds to stabilize the joints. But for bone density, okay, another thing is when you have some kind of impact, it should be such that you can tolerate it, like bouncing like that will help build up your bone density because it causes more greater force onto your bones. So today we're going to do something fun. I love this. I think this is really fun. Everybody's done these jumping jacks, right? So now we're going to build up elasticity, make our joints more resilient. So jumping jack, just like that. You don't have to do it fast. You can just kind of go slow if you want to, whatever you can personally do. And I'm going to count like 10-second intervals. So first we're just going to do just the standard jumping jacks. Okay, ready? When you're ready, we're going to do 2 sets of what I'll say about 10 seconds. And you start at your own pace. When you're ready, you start. Okay, and just rest. I love this too for the cardio part, right? Okay, it's an easy way to get a lot of really important implications in. Okay, again, same one side, just regular jumping jacks. and rest. Okay, now the fun part. So now we're going to do diagonal. So your middle, and then you go like this, diagonal, then middle, and then diagonal. So it looks like this. I'll do it a bit quickly. So this is middle, and then we'll go diagonal, 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 diagonal. And just rest. Okay, again, diagonals. Okay, and rest. Right. Okay, and then we'll do one more series. You can always just do the original one, right? Just straight old jumping jacks if you want to. And you can do it like really slowly, like, you know, if your knees are sore or your feet or something. But build up over time, you'll get a lot better. So the last one is circles. So you're in the same spot and you're hopping in that spot and you're doing a circle as you hop. So I'm going to go counterclockwise first. And then you go the other direction. And rest. So like I said, you're doing all the angles of rotation in all of your joints. So this time we're going to go circles again if you want, but start the other direction. So I'm going to start clockwise this time. And then rest. Okay. And we'll finish off one last time, just regular old jumping jacks. And then done. And now walking around, and you'll notice how the joints feel really good. We do need to keep building elasticity. So thanks very much for coming. Look forward to seeing you next week. Have a good time.